Hi, I'm Nathan Young, board certified sports physical therapist with Yada Yada. So you sprained your ankle, now what? The first thing I want to do is talk about what we call the Ottawa Ankle Rules. There's a few things that I want to point out. One, we have a small bone at the lateral part, we call it the fifth metatarsal. If it's pain there, you should get an x-ray. We also have two bones that come down your ankle. We call these your malleolus. You have your lateral malleolus on the outside and the medial malleolus on the inside. If there's tenderness on this bone, especially the posterior third, you should get x-rays. And the fourth thing is if you cannot bear weight after you sprain your ankle, you should get an x-ray. So at this point, you need to go follow up with a physician and get x-rays and see if you have an ankle fracture. The second thing I want to talk about is the type of ankle sprain. So we have three main ways that we can sprain an ankle. The most common way is what we call ankle inversion, and probably at least 80% are doing an ankle inversion sprain, and it's when your ankle rolls in, and so your ankle goes in and you twist your ankle. The three ligaments of your ankle that you can sprain is your anterior talofibular ligament, your calcaneofibular ligament, and your posterior talofibular ligament. If you sprain that, it's an ankle inversion. On the outside, if you go out and sprain your ankle, that's your deltoid ligament, and that'd be an inversion sprain. The third way is if you sprain a high ankle sprain and your bone kind of goes up and splits it apart and you sprain right in the middle of these two bones, and we'd call that a high ankle sprain. With a deltoid, possible fracture, or a high ankle sprain, you'll not be able to weight bear. The third thing I want to talk about is an ankle sprain. We grade this in a 1, 2, or 3, and that's the degree you're stretching the ligament. If it's a 1 or 2, you want to begin exercises. If it's a grade 3, you want to be in a boot and non-weight bearing for 10 days to 2 weeks. The last thing I want to talk about with ankle injuries is now what? You sprain your ankle, it's not fractured by the ankle Ottawa rules. What do we want to do? You want to do 4 things. First, I want you to begin weight bearing and walking on it. The second thing is you want an ankle brace. You've stretched out the ligaments, and just a simple brace where you could put on and lace it up, and this has a strap that you go around kind of like a figure 8 to give your ankle support. You want that brace on when you're walking and moving because your ankle is unstable and it wants to shift, and so that brace gives us that support of the ligaments to let it heal. The third thing is we want to get swelling out, so we want compression, some type of wrap or a compression sock to decrease it. And then the fourth thing is we want to do is elevation. Get your ankle higher than your heart, and you can do that at the same time with compression to start getting that fluid out of your ankle and back to your heart. And so those are the things to look at. So you sprained your ankle, begin with weight bearing, a brace, compression, and elevation. And then after a few days, you can start some exercises and see my video on beginning ankle exercises. Thank you and have a great day.